The World Health Assembly this year is continuing to look at the problem of chronic non-communicable diseases. The issue of the Zika virus is another big topic. On the NCDs, I think there's been a lot of good discussion on many of the risks that we face. I just came out of a session on promoting physical activity, which is a positive thing that prevents a lot of the problems associated with chronic disease. You feel better, you look better. So that's one that we really subscribe to. At the Caribbean Public Health Agency, we're trying to mobilize more resources and partners to work on the prevention and control of chronic diseases, seeing that this is our biggest health problem and our biggest preventable cost problem in the health services. And it's really odd that the Caribbean region is struggling to find economic growth. Last year we had 1% just about, and this year it's projected to maybe reach 1%. And yet things like diabetes and hypertension are eliminating 5-8% of the GDP. So my argument is put some investment on reducing those preventable impediments to development instead of only concentrating on trying to find growth, and finding growth is so hard. I think that's a key message for economic decision makers. In terms of what we're doing as well at the agency, we've started a new cancer registry hub for the Caribbean with the International Agency for Research on Cancer, CDC and NIH, so that's a good new initiative. And we have a policy initiative going with the trade and economic folks because they actually drive, their decisions drive a lot of the food environment, with a 6-point policy package for healthier food environments that includes mandatory nutritional labeling, improving the school feeding environment, reducing salt, fat and sugar in manufactured foods, promoting fruits and vegetables, and very importantly, fiscal and trade measures, such as aligning nutritional value to taxation. So, for example, taxing sodas and cross-subsidizing fruit and vegetable production. Those are some of the things that are needed to adjust the food environment and make healthier choices the easier choice. So I think this year at the Health Assembly, NCDs continue to be a big theme. For the Caribbean, we had some side meetings. The ministers who were there are obviously very passionate about it, and the need to re-establish, re-energize Caribbean leadership. The Port of Spain evaluation, the Port of Spain declaration, which is currently being evaluated, is a great sign of leadership that we're taking stock of where we are, what worked, what didn't work, and looking at how we accelerate multi-sector action going forward. I think we have to learn to be much better at talking to others, whether it's finance, agriculture, and not so much talk about disease, but frame it in ways that they understand the benefit that's going to be to them. It's tourism, finance, agriculture, and so on. So those are some points that I wanted to share from this year's World Health Assembly.